The fourth Emmy Award-winning procedure is going to be live March 14th here on AZTV 7, and I talked with Dr. Rizik about what we're going to be doing for this procedure. Well, Doctor, thanks again for having me in the office.
Love having you. As often as you want to come and look at these pictures of University of Michigan athletic prowess, we'd love to have you.
Against Notre Dame. All right, we'll leave that alone. But let's talk about this next procedure and how this actually clamp that we're using. It's not that. It's actually is it a clamp? Is that what we call it?
It's called a PFO occluder device or an Amplatzer device, and it really is more like a clamshell. That's the way we think about it. The original name for the device was a clamshell because, like a clamshell closes, this is going to close on both sides of the defect, the hole in the heart, and eliminate it.
But what is so important is that this literally might have not ever happened, because 14 years ago, people were like, no, this is not going to go forward.
What people are going to learn when they watch this live program, there's going to be several guests on, and what they're going to learn is that while we were pretty certain that these young patients having strokes, that stroke was due to a hole in the heart, and devices were developed to close that hole, that the studies and the science and the research was not completely clearly indicating that closing that hole benefited these patients. That maybe medical therapy, as poor as it may have been, was as good as it was going to get. That we might not have a good definitive method for closing the hole. And the studies went on, as your viewers are going to learn, the studies went on for 10 years, and then it was still another 4 or 5 years before the science was convincing that closing that hole would prevent a second stroke. And now we've evolved so far that we have such great confidence in the devices we have that we can virtually tell our patients with certainty, you're very, very unlikely to ever have to worry about this again once we close the hole with that device.
I'm looking forward to hearing that story, because it's, as you've been telling me here and there, it's just amazing how that happens. And also we're going to be doing some stories of some success of this, which is great to hear their stories, because someone out there right now might be, of course, going through a little symptoms of small strokes, as we talked about earlier, different things, and wondering what's going on. But that's also important too to doctors out there. And you got to kind of like be your own doctor. If you feel that on, maybe look at your own past medical health. Maybe you talk to your parents and go, Mom, Dad, did ever something happen to me, especially at a young age?
That is a great point, because the two stories that you're going to hear, both of these patients sought out health care from other physicians around the country, Massachusetts, Ohio, etc. And their initial studies were not convincing. The initial studies weren't definitive in terms of you had a stroke and this was the reason. It's when they came to us that we did additional imaging and were able to prove that not only did they have a stroke, but that they had multiple strokes due to that little tiny hole in the heart. So sometimes the first time you look at it, you're not convinced of what the diagnosis is. So to your point, you kind of have to be your own doctor and continue to seek out health care that solves the issue.
Yeah, I tell you, it's amazing. And that's why this next Emmy Award-winning procedure, we get to say that. That's nice.
We get to say that.
And the reason why it's an Emmy Award-winning procedure is because we talk to you in pretty much layman terms, and that's what I'm here to do, and you talk to me, which is really nice. And I love that our viewers have learned that way from it and has helped a lot of people. So now we're looking forward to helping people under the age of 50 and 60.
You have to talk to patients, not talk down to patients. And that's one of the key things that you learn in medical school is what we call medical communication, learning to talk to the patient in a way that they understand it. And you do a beautiful job of sort of taking what we do in the operating room and translating it to your viewers so it's digestible. Very, very important talent to have.
Well, you make it easy. And plus, too, I don't know what I'm doing in there. But coming March 14th, we will know what we're doing, and that is, of course, prolonging another life thanks to the procedure. So you guys stick around and watch it.
And I'm hearing from everybody the excitement that Brad Perry is back in the house.